Well, welcome in. Hi there, everyone. So my name is Dr. Jessica Fink, and I am the Director of Clinical Pharmacy Services at Progress Pharmacy. And I have my co-host here today, Dyllen. Want to introduce yourself, Dyllen?
Yes, and I'm Dyllen. I am one of the clinical pharmacists at Progress Pharmacy.
Why don't you tell us a little bit about what does it mean to be a clinical pharmacist at a compounding pharmacy like Progress?
I mean, a lot. It's a loaded question, to be
Yeah,
honest.
true.
We do everything. I mean, we go from compounding, creating formulas, personalizing them for each patient. When doctors call in, we're also basically an extension of their clinical team. A lot of these providers, whether they're novices, amateurs, or professionals, they've been in here for a long time. They always will have questions on, whether it be dosing, side effects, the best patient, who would benefit the most.
And do you feel like you get a combination of questions on non-sterile compounds and sterile compounds, or does one outweigh more than the other?
No, yeah, definitely. Questions on anything and everything.
Okay.
Definitely, we get questions on the sterols. The injectables are probably the most common questions because people are they're all the rave right now. Everyone
Yeah.
loves them. The efficacy is amazing on them. However, there are definitely non-sterile compounds, capsules and creams, things that are just as effective and they work just as well for depending on the diagnosis.
And I feel like some of the non-sterile stuff, wouldn't that be, is it better to say that that's a good starting point for a patient because it's a little less invasive versus jumping to something subcutaneous? Or do you feel like it's more based off of like the route and what it's actually trying to treat?
I think it's more based on indication, for
Okay.
sure. That's the best thing about being using a compound pharmacy is based on the indication. You can use different type of routes.
Okay.
There's a lot of injection fatigue lately coming in.
Yeah.
As good as injections are and how well they work, people are just tired of stabbing themselves every
Yeah.
night,
Yeah.
and I totally understand. So the fact that we can offer, alternative routes like nasal sprays, capsules, troches, creams, sublingual suspensions, whatever it may be that the patient would rather have, as long as it's still effective for them and what they want to use it for, it's just as good. I mean, biggest thing like a common one is like oxytocin, right?
Yeah.
It's all the rave right now. We've had a lot of people reaching out to us about cream.
Yeah, we did.
So,
That was such a hot day.
the hot topic right now is the creams, and I've actually already at Calm, I've talked to a couple of providers about it already, and they were very curious about it.
Yeah.
And being that they want to treat it for mood disorders, I recommend that they would just, I think the nasal route is a much better option for them. It's much more effective than I
Then
think
the
a cream would be. Yeah.
Interesting. Yeah, I felt like we had that one day at the pharmacy. There was like 3 phone calls in what, 2
Too
hours?
many. Yeah, too many. It must have been some video was circling around and people
Yeah.
wanted to get a piece of it.
But you and the clinical team, you guys got that formulation up and running fast. So,
Correct.
I think that's super cool. And I guess to maybe expand upon that, so what would you say, or when clinicians need to partner with somebody to figure out compounding, what does compounding pharmacy actually mean? What does that look like when they partner with a compounding pharmacy? What benefits are they getting as a clinician?
Yeah, I mean, so they get, another mind, right? They are able to personalize the medication now for this patient. They get another perspective on it. They understand now that they have someone that can go over pharmacokinetics with it and
Yeah.
really determine, is this route correct? Or should we be doing this? Or should we do something else? Should we try something else?
Yeah.
I mean, and that's kind of what I had a lot of talks with about comparing that cream to the nasal spray that more effective for this indication.
Yeah.
Due to the pharmacokinetic ability of it,
Yeah.
I would choose the nasal route.
And then what about when it comes to the injectables? What makes it more beneficial to partner with somebody like us, a compounding pharmacy, versus online pharmacies
Oh,
or the commercials that we see on TV? What makes us
Yes.
better for partnering on that side?
I would like to say it's relationships first. I think we have really good relationships with providers.
Yeah, we do.
I
know you
love,
do.
I love my certain provider, man.
Yeah.
They're awesome to talk to. They're great. I love how they make me feel like I am really part of their team. Like I'm right there with them every day, going over patient cases,
Yeah.
deciding what would be the best for this patient. And unlike you can just Google peptide nowadays and just anything can come up, right? I mean, who
TikTok,
knows?
Instagram, all of it.
Exactly.
Yeah.
And what makes us a safer, better pharmacy would be, everything we source they are from FDA registered facilities. These
Yeah.
aren't just random drugs we're pulling in and making something
Yeah.
fun with them, right?
Well, and it takes a lot, I feel like, for us to even want to partner with somebody else, to be a pharmacy partner. We do our own extensive investigation.
Oh, yeah.
You know, we keep our own compliance as the main central fill pharmacy, but then we also investigate their model, right? So I feel like the fact that we're able to pull the C of A's, we're able to look at the legal, the compliance on behalf of the
Oh, yeah.
clinicians, that way they just know they can trust us that we're doing our due diligence versus, you know, they don't have to worry about that. I feel like that's,
Exactly.
you know, I mean, how many times do we pull a C of A?
Too many. I mean,
Yeah,
if
and it's
you-
quick. It's a quick process.
It's a very quick process, you know, because we handle everything, we store everything correctly.
Yeah.
We do, like you said, we do our due diligence. We have the
Yeah.
stability test, we have sterility testings, we have
And the
endotoxin
shipping testing,
testing,
too.
and
We
they
did-
should.
yeah.
And that is how, because when you're injecting these things into your body, I mean, you want to make sure you're getting the best of the best.
Right, yeah. Well, especially the fact that Progress is located in one state and we ship out to so many patients in other states, I think that brings its own complexities of compliance and legality that
Yeah.
we don't want that to fall into the clinician side. We want it to fall on our side or, you know, take charge and leadership of that. So I think we do a pretty good job of that, but I don't know if everybody else does. Or
Yeah.
at least maybe not everybody else thinks of it right away.
There's actually certain providers where, you know, they are aware of other places they could go, and, you know, due to just our, you know, our openness and our relationships with them, they've told me personally they just won't go to any other pharmacy.
Yeah.
They
Yeah.
choose us.
Which we
always.
love.
We do. We love it.
Yeah, we love our partners and our providers. So maybe let's shift gears just a little bit and more on the peptide side and longevity space. So what does that look like to you and what you've been learning and what does the future look like?
Peptides are fascinating.
Yeah.
They're a hot topic for a reason, and it's just because of the effects they have and how just wonderful they can be. You know, my favorite thing about peptides when I talk to providers is the therapeutic windows of them.
Yeah.
They can, you know, heal. They do so many things, incredible things for your body, and they have such a great safety index where, you know, you don't have to worry too much about the side effects. And the side effects are very, you know, minimal, if any. And, you know, that's probably one of my favorite things about peptides. They're definitely going to be in the future. I know that, you know, just recently, actually, I don't know how many people watched the podcast with RFK and Joe Rogan.
Yeah.
They
that's a
did
good
mention that, you know, there are compounds that we were allowed to formulate, and now they were on the list we couldn't, so we haven't been able to.
one. Which is exciting.
But it's exciting that, you know, he
Yeah.
is talking about bringing a lot of those back, and I know providers are going to be very excited when they see
Open that door.
what they can have again. Yes.
Yeah. So how important do you feel like dosing or having a precise dosing it is when it comes to peptides and
Oh, yeah.
longevity medicine?
That's very important. You know, more is not always better, right? People like to think that just because, you know, these things are so great, there's no side effects, you can dose it high, right?
Yeah.
That leads to, you know, receptor desensitization. It can lead to higher side effects, and it can lead to just, you know, those unnormal physiological symptoms and outcomes, which is not what we're going for.
No, definitely not. So out of fun curiosity, if you had to pick one peptide that's your favorite, what would it be and why?
Man,
It might be too hot of a topic.
that's
question.
tough. Picking one is tough.
Or at least what's one that you see like the most benefit from?
I would have to say out of not technically, you know, a specific peptide, but more of a group, I do love growth hormone-releasing hormones.
Okay.
So sermorelin and tesamorelin,
Okay.
I think those are just probably my top peptides just because they have such an overall effect on everything and anything. And they're pretty good at it, you know.
Yeah. You do bring them up a lot at the
Yeah,
pharmacy.
that's definitely probably one of my
Yeah.
favorite peptides ever to always recommend, almost in any situation, whether it be pain, you know, inflammation, muscle gain, you know, preserving muscle mass, memory, increased sleep. I mean, I can go on and on.
It does it all.
It really does.
Awesome. Well, I know at Progress Pharmacy we're going to be launching protocols. We're going to be doing a new protocol every month. So what's our current new protocol that we just launched? What's our very first one?
The new one right now is called the Prime Body.
Okay.
It
a fun name.
includes, yes, great name. Whoever came up with it, they need a raise. So, it includes a growth hormone-releasing hormone like sermorelin or
One of your
tesamorelin.
favorites.
As you guys already know, that's to help preserve that lean muscle mass. It also helps with the aesthetics, you know, keeping your hair strong, your skin glowing.
Okay.
Better overall sleep, that will help decrease your cortisol, right? We pair that with NAD.
Okay.
NAD is, as we know now, basically one of the foundations of longevity.
Yeah.
Pretty great for everything, you know, mitochondrial regeneration, metabolically, and it's just awesome for activating those sirtuin pathways, right?
Cool.
It's needed. And then we also are going to pair with your GLP-1, of course,
Okay.
weight loss, help you with that, inflammation, whatever you might be using it for, depending if you're microdosing. things
Okay,
like
and
that.
our GLP-1 in that Prime Body program, is it injectable ones or is it also the oral ones?
I believe right now we are going to keep it injectables.
Okay.
There is talks, that we will be having
Something down the future?
some in the future with
Okay.
capsules, yes.
Okay.
The studies are coming, so we're waiting.
Got
we
it.
like to be safe. We always wait.
Got it. So keep it with the sub-Q for now.
For right now, it is
Got
just
it.
the injectables.
Okay.
And then the last one, of course, we always want to throw in IsoWater, right?
Okay.
One of the best supplements for all GLP-1 users. Even if you're not on a GLP-1,
Yeah.
it's easily one of the best and one of my favorite supplements to help, prevent that protein degradation.
Yeah.
Help you with a better recovery.
And this is one of my favorite things that I've learned from you every single time we get pharmacy students and they learn about iCell and the GLP-1. But you always talk about one thing specifically with the iCell and
Yeah.
the GLP-1s with the thirst.
When you went to school, you always knew it definitely suppresses hunger. But what a lot of people don't say is, it suppresses hunger, but it also, deceives your thirst perception as well.
Yeah.
So most people aren't going to be drinking as much water, and that kind of leads to a lot of these side effects that people come across. It's not the actual medication itself, the GLP-1. It's just lack of nutrients, lack of hydration,
Yeah.
which is, I just think it's really cool. When I
I do
learned
too.
that, I thought that was
I mean, we don't want our patients to be not hydrated,
Of course,
but
no,
we
no.
think it's a cool
It was a
pathos
very,
side. Yeah.
very interesting thing that no one really talks about.
Yeah,
that.
I love it when you do talk about that, and every single time you talk about it, the pharmacy students are like,
It's
just mind-boggled by
It
it.
is.
So
You don't think about it, and it's such like a when it comes up, you're like, oh, that makes sense. Like,
Right.
of course.
Yeah.
And you just don't think about it.
yeah. So if that's our current protocol, then what are maybe, I know we don't know our next protocols, but what are some ideas that we've been talking about that you've heard of? Anything?
I
Leave a
would
teaser?
like a couple of them. I'm not gonna lie. I have talked to our business development research team. Some combos we could create.
Okay.
I'm a huge fan of NAD. NAD, of course, other supplements that New Buyers supplies like Apigenin and 1-MNA. I think that is a power combo. Those
Okay.
three even. Maybe if you could do like a mitochondrial booster peptide
Okay.
one. Throw in like.
What about like a gut side protocol? Too?
Gut tide protocol is always the best.
It's always needed,
We
right?
have the gut tides right from them. We have new butyrate.
Yeah.
And then, another great peptide I also love, which is a capsule. So patients love that as well. Lorazepam.
Okay.
I think that'd be a fun one. That'd be
Okay.
a really good one.
So it sounds like we maybe got some pipeline
There's-
coming down the road.
That's the best thing. There's so many great options out there that, if one doesn't work, there's so many other options you can just try. Just try it.
Okay. Well, more to come, it sounds like.
Yeah.
Well, thanks for your time today, Dylan.
Thank you, Jess.
Thanks.